Reddit, what's your most embarrassing doctor's office story? I'll start. So yesterday I went to the doctor for some intestinal bleeding. My doctor is fairly new to the office and I've only met her once before this. I'm only 21, so I've never had a reason for a doctor to go knuckle deep in my rectum before, but the doctor insisted it needed to be done for some tests. So I bend over the table, she up and digs for treasure. I hadn't pooped in a day or so because it hurts when I do, so I was a bit stopped up. Upon starting to pull out, I immediately realize what's about to happen and try everything in my power to stop it. Too late. Doctor pulls her finger out and plop, out lands a turd, right on the floor. I was able to hold back the rest, but the damage was done. TLDR pooped on the floor of my doctor's office. Now it's your turn. Mine's not so much embarrassing as it is awesome. I had the mumps during my first year of college, and along with that I got orchitis, swelling of the caused by the mumps, in my left nut, which swelled up to the size of a potato. It was really painful and heavy, so I had to carry it everywhere for a while. So I went to the doctor's, he checked my mumps and then I told him there was another problem. I dropped true, lay on the doctor bed thing, and he came over to examine. He laughed when he seen it, cause it was freakin' huge, and said, "What seems to be the problem?" jokingly. It was at that moment that I pointed to my regular size bollock and said, "This one shrank." Cue 5-minute laughter fit from the doc. I had to go to a specialist urologist due to pain in my ding dong. My wife, who is awesome, accompanied me for support. The doc was at a teaching hospital, so he asked if a couple of med students could observe the exam. I say okay, my dignity was already at a new low anyway, so why not? I drop tro and the doc starts yankin' and pullin' on mini-me. He takes some notes and then directs the two med students to cop a feel right where he did. I happen to look over at my wife, who is trying to stifle a smile while watching three dudes essentially whack me off. TLDR, my insurance paid for the most awkward in the history of time. While my wife watched. When I turned 30, I suddenly became a hypochondriac. I thought that everything was cancer, or worse. So I'm seeing my doctor, who was a racquetball buddy, for an annual physical, and I mentioned that I was having some pains in the left side of my chest. I asked him, "I know this is rare, but could it be breast cancer? I'm male BTW." He felt around seriously, then with an absolutely straight face asked me, "Does the pain hurt worse when you have your period?" That was pretty much the end of my year of hypochondria. This actually occurred shortly after I was born, and we refer to it as the green pea incident. My brother, 2 years old, was moving to solid foods, and absolutely loved peas. Mushed, boiled, fried, or in things, he loved them. One day, my mom noticed that my brother wasn't going to the washroom. No big deal, she thought. It's only been a day. 2 days later, nothing's coming out. He kept eating and eating, like the happy little fat toddler he was, eating all amounts of peas. My parents scheduled a day off work and took him to the doctor together. The doctor, of course, says that he must be constipated. It happens to the best of us. At this point, it's been 4 days since the little has taken one. The doctor gives him a large dose of prescription strength X-Lax, and suggests that they should probably keep an eye on him for the next while. As he's talking to my parents about what they should do, my brother starts to bright, neon green. He had eaten so many peas that the fiber had actually clogged him up, and now it was returning in force. The semi-liquidated started flying out, faster and faster, like you see in those comedy movies. Eventually, it settled down to a light stream, but not before his mist had covered the entire wall next to the examination table. Neon green mist. All over the doctor's tools, his blood pressure stuff, and his posters. It ruined the cushion on the table, and stank to high hell. My parents never went back to that doctor again. TLDR, neon green mist. When I was newly pregnant with my daughter, I was at my OB's office for a pelvic exam. After I stirrup up, my doc is knuckle deep in my and says, "Oh, you'll be fine if you have a big baby, there's plenty of room in here." I'm sure she meant that I have a wide pelvic arch and would have no trouble with AL delivery, but what I heard was, "Wow. I see dozens of these every day, but you have a huge, gaping." Last time I went to the OB/GYN, the doctor, female, just shoved her fingers in me without any warning so she could check my ovaries. I'm used to having doctors that do my exams at least warn me a little before they just cram up there. But nope, not her. After that wonderful incident, she pulls off her gloves and goes, "Wow, you are extremely tight. If you ever have a child, I would never suggest you give birth." Didn't even understand that she alarmed me and my so much. How the hell was it supposed to be relaxed in any way? Uneasy face. I'm definitely finding a new OB/GYN this year. So I used to always get pilonidal cysts when I was in high school. From between 13 to 18 I had it 5 times, which according to my doctor is a lot. These things used to hurt bad. I'd get them right above my tailbone and it would feel like the tailbone was broken. If I didn't get it dealt with right away, I wouldn't be able to walk from the pain. The last time I ever got one was horrible. It was Halloween and I was at my friend's house when I noticed it starting to hurt. I knew right away what it was. The next morning I had my mom take me to the doctor's office, but because it was a Saturday my family doctor's office was closed, so we ended up going to a walk-in clinic. The doctor took a quick look at it, said it wasn't the problem, and set me up for an X-ray. By the time the X-ray was over, it was hurting beyond anything I could imagine. It felt exactly like one of the cysts, but I trusted the doctor's word. Later that evening the pain was so severe I had to go to emergency. At the hospital, the doctor there took another quick look at it and told me it was nothing. He prescribed me some pain medication and sent me on my way. That night was horrible. I was terrified. I thought there was something severely wrong with me. I thought I cracked my tailbone after I fell over a balloon at my friend's house or something. On Monday, after a weekend of intense pain, I could finally go see my family doctor. I remember the waiting room being filled with people. It hurt too much to sit, so I stood in the corner with my back bent weird because it hurt too much to stand straight. All of a sudden, I felt instant relief, followed by a smell that was quite honestly the worst smell I ever smelled in my entire life, even to this day. It smelled like death. The people around me could smell it too. Everyone started coughing, but trying their best not to offend. I could feel my pants were completely wet with the pus of my cyst. When my name was called I was so embarrassed. Everyone knew the smell was coming from me, and now they could see my drenched clothing. I mean, it was like I had just dipped the top of my pants and the bottom of my shirt in water, that's how wet they were. The faces of the people were that of utter shock. They must have thought I pissed myself. Later in the doctor's office, the doctor took one step inside the room and said, "Ah, another cyst." He knew just from the smell what it was. He took a look and said it was the biggest one he had ever seen. He signed me up for surgery, before I just gotten little siggies just for him to pop for cyst. Not a surgeon was going to remove the skin around the area so it would never return, and I have never had one since. Yikes, that's rough. I once had a PCE as well, but it was more of an open sore and my 20-year-old self waited far too long to seek medical attention, thinking if I bandaged it it would eventually heal. Nope. Fast forward 8 months later. I finally told the doctor, I don't know why, but my butt crack keeps bleeding. And a week or so later, I had a chunk of my upper butt crack roughly the size of a golf ball surgically removed. I was also pretty hirsute, so I ended up revisiting my butt doctor every 4 weeks for about a year, to keep the area around it shaved. Damn, surgical wound didn't close completely for almost 2 full years. It was apparently in an inconvenient spot for healing. At least the doctor was a good guy with a sense of humor, so my ordeal was a lot more bearable than it could have been, given the circumstances. 7 years later and it's still gone. Not me, but when I was in the waiting room of the hospital for a broken toe, I saw a somewhat elderly man, 50s to 60s, come up to the nurse's desk and cough quietly. She waved him off as a sign to tell him to wait a minute and he started to pace nervously. He was able to catch a male nurse walking by and tried to discreetly tell him he needed immediate medical attention. I was wondering why the guy was so antsy, and that's when I noticed it. The guy had a mixture of brown and red fluid leak down the back of his thigh from his shorts. The male nurse asked him to speak up, and even though he was quiet, I heard him mutter, "I've got a so far up my that I can't reach it, and I don't want the entire damn hospital to know about it." The male nurse seemed to hesitate a bit and motioned him to wait in an isolated room. Dr. Older gentleman had a shoved too far up his and started leaking on the floor.